Well, the next normal contour is the aortic arch, and you can see that little bump there. And we just saw it in the last CT slide, but we'll show it again. And to help you picture it, you can see there's the ascending aorta. It comes up, makes this arch, and when you're looking at it from front to back, it can be sort of compressed. And there's that bump. That's the normal bump of the ascending aorta and the aortic arch. Let's go to the CT scan. Again, there's our aortic arch, and it makes a contour with the lungs. Our eye in the sky looking from the front, you can see that. We fade and peel back. We peel back. There's the aortic arch. You can see how the aortic arch is right there. If you go down inferiorly, the next bump is going to be left pulmonary artery. The next bump after that will be the left atrial appendage, and the last bump will be the left ventricle. We'll get to that. But right now you can see that that bump near the top there is the aortic arch. You can see the three great vessels coming out of it. Here's an abnormal cardiac, abnormal chest X-ray. We see our aortic arch, and there's a second contour that you can see in addition to it. Because you can see a line going through it, it's not right on the descending thoracic aorta, but it's in the neighborhood of the aortic arch. Again, the most common thing in most patients probably would be some sort of mass, like a adenopathy or a lung cancer. But the point of this is to show that these structures really are what we say we are, what I'm saying they are. And so we're going to show you cases where things are abnormal. So there's our bump. Doesn't belong. Fade away, overlay the CT scan, and peel back. And there's the ascending aorta, and it comes around, and right where it starts to go back, there's an abnormal bump. This is an aneurysm, an abnormal bulging, outpouching of the aortic arch. And it's very focal in this case. We'll rotate around, and you can see it there. We'll overlay the lateral, and you can even see the bump there too. So, what was done with this? Here's an angiogram. There's a catheter in the ascending aorta. It goes across, and you can see the focal bulging there. So, this was treated by putting a stent across it. You put a stent right across it, and so the blood flows up the aorta through the stent and doesn't flow into that aneurysm to make it less likely to pop. The problem is these great vessels get covered up, so what was done was one great vessel was left open through a hole in the stent, and then it was connected to the other great vessels through grafts. This is called hybrid revascularization. Hybrid meaning part surgical, part stenting. And so that's the aortic arch. And here is that same patient now with a stent in place. You can see it there. And again, this helps you see that that bump really is the aortic arch. Here's a new patient. If we look at the right side, we're missing our aortic arch bump. This person has an aortic arch on the right side, which is a congenital anomaly. You can see that it's deviating the trachea, which is the airway, to the patient's left. We overlay an angiogram. There's a catheter in the aortic arch, and you can see how that bump really is an abnormal aortic arch on the right. And there it is. You can also see that when we inject the aortic arch, we're starting to get filling into the vessels into the lungs, which is also not normal. This patient had pulmonary atresia and a ventricular septal defect, a VSD. Pulmonary atresia means the right ventricle didn't connect to the pulmonary arteries. The pulmonary arteries were floating. They were getting their supply from collateral vessels and from the aorta. That's why the hyla were so small. Here we're injecting our catheter, come on catheter, is injecting these collateral branches that supply the pulmonary arteries, which you will see here in a second. So this catheter in the aorta is injecting these collaterals, and they wind up supplying the pulmonary arteries. That's why this patient's hyla were so small. Now there's nothing there where the left pulmonary artery should be. New patient. Look at the region of the aortic arch. Does anything seem unusual? There's an extra soft tissue right there on the patient's right side. The trachea is narrowed and displaced to the left. So it's a little bit like our last case with the right aortic arch, but there's still a bump on the patient's left as well. Let's fade away. Pull up the CT scan, and now we see their aorta comes up, splits, and it actually merges in the back and forms a descending thoracic aorta. This is a double aortic arch. Let's rotate around, and you can see how these two arches come together. Two great vessels come off one arch, two great vessels come off the other arch. Put the lateral on, and it's hard to see too much that way. New patient. Look at the region of the aortic arch. What do we see? There's one contour and another contour. Gee, we were only supposed to have one. Now we have two. There are going to be two structures that have separate interfaces with the lung. It's a double contour. Fade away, peel back, and we see that this patient has a very tight narrowing of the descending thoracic aorta there, which is called a coarctation. And we have two contours. One of these is a large left subclavian artery in the back there, and the other one is a large proximal descending thoracic aorta there. It's not the classic figure 3, which is a typical, it looks like a number 3 on the radiograph, and it happens because of the shape of the aorta and the dilated distal descending thoracic aorta, which isn't present in this case. But if we rotate around, you can see just how narrow that aorta is there. If we rotate some more, there again, there's that super narrow coarctation, a dilated left subclavian. Pull up the lateral. Also, if you look carefully here at the ribs, you can see that there's little grooves underneath the ribs. That happens from collateral vessels that are coming from the upper extremities. They're going backwards through the intercostals under the ribs and draining into the descending thoracic aorta. They get so big that they start to erode under the ribs, and that's called rib notching, which is a classic chest x-ray sign that you see in coarctation of the aorta.